Are you experiencing painful, persistent bloating, chronic constipation, diarrhea, or both? Chronic B vitamin or iron deficiencies, or compounding bloat throughout the day? Have you developed FODMAP sensitivities that you never had before? Did any of these symptoms start following a triggering event like a long season of stress, abdominal injury or surgery, food poisoning, a celiac diagnosis, or antibiotic, PPI, or long-term NSAID use? If you're answering yes to many of these questions, you may have SIBO. In today's video, I'm deep diving SIBO with you. I'm going to cover what SIBO is, what it is about endometriosis that makes you more likely to develop SIBO, how SIBO can make endo symptoms worse, and lastly, tips and tricks for effectively treating SIBO. If you haven't already, please give this video a like, share it with a friend, and hit that subscribe button. Now on to the video. Let's first define SIBO. So SIBO stands for small intestinal bacterial overgrowth. SIBO occurs when bacteria that normally are found in the large intestine translocate or move to the small intestine. This can cause symptoms like bloating, abdominal pain, diarrhea, constipation, FODMAP sensitivities, nutrient malabsorption, and even skin concerns, fatigue, brain fog, and even restless legs. For people with endometriosis, SIBO is more common than in the general population. Some studies predict SIBO prevalence is as high as 91.9% in endometriosis patients. But why? There are several reasons why SIBO is more common in people with endometriosis compared to people who do not have endometriosis, and here are a few reasons why. The first is anatomical abnormalities and adhesions. Endometriosis can cause scar tissue and adhesions in the pelvis, which may slow down gut motility and allow bacteria to pool in certain parts of the digestive tract and overgrow. Specifically with SIBO, it would be in the small intestine. Another reason is surgery. Having surgery can increase the development of scar tissue, which is a risk factor for SIBO. Additionally, anesthetic slows motility, which is also a risk factor for SIBO. Antibiotics disrupt the balance of gut bacteria and increase SIBO risk. Many anti-inflammatory strains of bacteria that colonize the bowel produce something called short-chain fatty acids, one of which is butyrate. Butyrate stimulates peristalsis in the bowels and controls serotonin release, which is a natural motility agent. If you have less of these short-chain fatty acid producing bacteria due to recurring antibiotic use, then it can affect motility and therefore predispose you to SIBO. Another reason is medication use. Frequent use of NSAIDs or smooth muscle relaxants like progesterone and progestins can affect gut motility, contributing to bacterial overgrowth. Another reason is stress. Stress increases the gaps between the cells that line your gut. Leaky gut results, which is a risk factor for SIBO. Stress also pulls resources away from digestion, slowing stomach acid secretions and slowing digestive enzyme production, which are two risk factors for SIBO. And I think we can all agree that living with a chronic inflammatory condition and or chronic pain is quite stressful. Another reason is MCAS, mast cell activation syndrome. This is common in people with endometriosis. It's a condition where mast cells, cells of the immune system, release an abnormally high amount of chemicals into your body. This can result in rashes, anaphylaxis, swelling, low blood pressure, difficulty breathing, and diarrhea. The increased risk for SIBO comes from MCAS's potential for causing gut barrier issues. Another possible risk factor is autoimmunity. So autoimmunity is a risk factor for SIBO, and unfortunately autoimmune conditions are more common among people with endometriosis. Ehlers-Danlos syndrome is also more common in people with endometriosis. Ehlers-Danlos syndrome affects the connective tissue, making it fragile and more susceptible to scarring and adhesion formation. Having scar tissue on or around the parts of your digestive tract can impact motility and slow transit time, which is a risk factor for SIBO. Interestingly, celiac disease is more common in people with endometriosis as well, which also increases SIBO risk. So what are some consequences of SIBO and endometriosis? When SIBO develops in somebody with endometriosis, it can make life even more challenging, and here are a few reasons why. The first is poor nutrient absorption. SIBO can cause malabsorption of both macro and micro minerals. Vitamins like B12, iron, and fat-soluble vitamins like vitamin A and D can be malabsorbed, but your body can also struggle to break down proteins, fats, and carbohydrates. There is a large body of research that highlights how various nutrient gaps increase oxidative stress or can overlap with more pain symptoms with endometriosis, and I have many videos on this topic. For example, low magnesium can increase cramping, vitamin D and or zinc deficiency are both associated with endometrioma development, and iodine and selenium deficiency can negatively affect the thyroid. And as we've talked about at length in other videos, hypothyroidism is associated with more severe forms of endo and more pain symptoms with endometriosis. Another way that SIBO can make your quality of life worse as somebody with endometriosis is via mucosal damage. So overgrowth of bacteria can irritate the intestinal lining and increase gut permeability. Increased gut permeability is a risk factor for LPS to move from the gut into the blood. LPS, or lipopolysaccharides, this is a toxin that is associated with more severe forms and symptoms of endometriosis as well. Another reason how SIBO can make your quality of life worse as somebody with endometriosis is through inflammation. So SIBO contributes to systemic and gut inflammation, which can worsen endometriosis symptoms, brain fog, sleep issues, energy, and fertility outcomes. Another way it can affect your quality of life with endo is through overproduction of gas. This leads to bloating, distension, and abdominal discomfort, which can further amplify pelvic pain and pressure from endometriosis. This can also exacerbate underlying food sensitivities. Okay, so now let's talk a little bit about how SIBO is diagnosed. We do not currently have a super fantastic, accurate, and accessible way to diagnose SIBO. The best, most accurate way would be through a biopsy of the small bowel, but of course, this is not accessible to most people. The best method we currently have available for diagnosing SIBO involves a breath test. This breath test involves drinking a sugar solution, specifically lactulose or glucose. When you consume this fermentable substrate, bacteria will ferment it as it travels through the digestive tract. Assuming there is bacteria present, gas is produced, it enters the blood, circles up to the lungs, and exits the body in your breath. This is what is captured on the SIBO breath test when you exhale into the small tubes that are provided in the testing kit. As mentioned, there are two substrates from which you can choose, glucose or lactulose. I personally prefer to use lactulose as it's not absorbed high up in the small intestine and will be fermented by gut bacteria in the large bowel. I like to see how high the numbers that are reflective of the large bowel environment get. This often informs my care plan. Because lactulose is not absorbed in the small bowel, it measures bacterial overgrowth both in the upper and lower part of the bowel, making it better for detecting more SIBO cases. One of the disadvantages of lactulose is that it may cause more bloating and gas than glucose, and it can produce false positives since it moves right through to the end of the large bowel. Because the lactulose moves from the upper part of the small bowel through to the end of the large bowel, you can see an overlap between gas produced in the small and large bowel fermentation, which can make numbers appear higher than they are. This is part of how the lactulose substrate can generate false positives. Glucose, on the other hand, is rapidly absorbed high up in the small bowel. Using this substrate can potentially miss bacterial overgrowth in distal parts of the small intestine. Despite the potential for missed SIBO, the glucose substrate is generally more specific. You can mitigate many of the risks associated with a false positive SIBO result by doing your test prep correctly and comparing your symptoms against symptoms of SIBO. I guide all of my patients on doing a 24 to 48 hour no fiber diet prior to the test collection. This diet includes only plain chicken, plain fish, white rice, eggs, oils, weak black coffee, and salt and pepper. If you eliminate fiber, you reduce fermentation, and the chances of a false positive are strongly reduced. I have all my clients complete a transit time test before completing their SIBO test as well. If your transit time is over 48 hours, I absolutely recommend that you complete the prep over 2 days. Additionally, be sure to come off all supplements and medications that affect motility or gut health. This includes but isn't limited to things like ovositol, vitamin C, probiotics, prebiotic fibers, magnesium oxide, magnesium citrate, and iron. Medications like proton pump inhibitors, over-the-counter anti-inflammatory medications, and metformin would also need to be removed temporarily, but consult with your practitioner about when it is safe to do so. You should not complete a SIBO breath test any sooner than 4 weeks from the last dose of an antibiotic as well. The diagnostic criteria for diagnosing SIBO includes the following: a 20 parts per million rise from the lowest preceding value within the first 90 to 120 minutes for hydrogen. This is an example of a positive hydrogen result. In this example, you can see the lowest number is 6, making a result of 26 or above positive within the first 90 to 120 minutes. A 12 parts per million rise from the lowest preceding value within the first 90 to 120 minutes is diagnostic for methane. This image shows you an example of a methane positive SIBO result. The lowest value is 9, making anything 21 or above within the first 90 to 120 minutes positive for methane, and we see 22 at the 45-minute mark. A 3 parts per million increase or over at any point throughout the test for hydrogen sulfide is also considered positive. Hydrogen sulfide SIBO can only be diagnosed through a specialty test called TrioSmart. Hydrogen sulfide often presents with sulfur-smelling gas, diarrhea, and cognitive symptoms like brain fog and forgetfulness. So now let's talk a little bit about treatment. Treating SIBO can be challenging, especially in people with endometriosis, but there are effective strategies available. The 3 most well-recognized ways to treat SIBO include antibiotics, antimicrobials, and the elemental diet. Now, before I jump into these treatment options, there are 5 vital elements to a successful SIBO treatment, not just in people with endo, but anybody who is treating SIBO. The first is digestive support. You want to make sure you are supporting digestive function with good digestive health habits like chewing well, eating seated, and spacing your meals. Additionally, some people require digestive supports like bitters or a digestive enzyme. The second is liver support. The liver is integral to a successful SIBO treatment for many reasons. For starters, it supports bile production, which in and of itself has antimicrobial properties. The liver also detoxifies many of the harmful byproducts produced by SIBO bacteria. These toxins can enter the bloodstream, clogging up detox pathways, which in turn affects the success and efficacy of your protocol. The liver also processes the various vitamins and minerals needed to support optimal digestive function. Liver support can look like consuming a bitter tea in between meals, increasing your intake of leafy greens every day, digestive bitters, or supplements like TUDCA or Liver Support PX. Third is nervous system support. SIBO is a stressor on your body, and we haven't even considered other things that might be affecting your nervous system, like inflammation or high estrogen, in addition to SIBO. Stress slows digestive enzyme production and motility, which we've already established are huge root cause issues for developing SIBO in the first place. Nervous system supports can look like sleep supporting apps, deep breathing, movement, electrolytes, magnesium glycinate, or adaptogenic herbs like ashwagandha. The fourth element is adrenal support. Your adrenals work together with your nervous system, helping to regulate how your body responds to stress. If your adrenal glands are stressed, your sympathetic nervous system will be activated, putting you into fight or flight. Adrenal supports can look like the nervous system supports we talked about earlier, but also don't forget the unsexy basics: sleep, exercise, blood sugar balance, and stress management. And the fifth element to consider is a treatment diet. If your digestive symptoms are aggressive and disruptive to your quality of life, I would highly suggest starting a treatment diet prior to starting your SIBO treatment. Putting antibiotics or antimicrobials into an environment that is already irritated and inflamed is like throwing gasoline onto a fire or salt into a wound. The treatment diet I like to use is called the restrictive biphasic diet or the semi-restrictive biphasic diet. It works by controlling fermentation by prioritizing foods that are good for your gut but also don't contain large amounts of fermentable sugars or FODMAPs. The length of time you spend on the treatment diet depends on your symptom severity. In very severe cases, I often recommend doing the diet for the entirety of the treatment. In moderate cases, I recommend prepping your body for treatment with 5 to 7 days of a treatment diet and spending roughly 10 to 50% of your treatment window on the diet. In less severe cases, I recommend only limiting foods that personally irritate you or that you know are problematic. Often, this does include gluten. Now onto the treatment options. I won't spend a lot of time on the elemental diet. This is a liquid diet made of pre-digested nutrients that are absorbed very high up in the digestive tract, essentially working by starving bacteria while still nourishing you. It's often used in severe cases as it's shown to reduce the overgrowth by 50 parts per million. However, it's very difficult to complete and it's most effective for hydrogen dominant SIBO only. Antibiotics are another form of treatment for SIBO. Rifaximin is commonly used for hydrogen dominant SIBO, and if you are only positive for hydrogen dominant SIBO, you would only require rifaximin. Some people also call it Xifaxin. A hydrogen methane positive SIBO or a methane only positive SIBO must be treated with neomycin or metronidazole in addition to rifaximin. I just want to clarify, if you're positive for both hydrogen and methane, you would require either the metronidazole or neomycin in addition to rifaximin, but if you're only positive for methane and not hydrogen, you wouldn't need the rifaximin. In addition to these antibiotics, you must always consider the 5 key vital elements to a successful treatment mentioned previously. Because rifaximin solubility improves in the presence of bile salts, I always include bile salts or TUDCA in antibiotic treatments, including rifaximin. Lastly, antimicrobials. Antimicrobials include herbal antibiotics. These include herbs like berberine, neem, candibactin, microbiome cleanse, or biocidin. In practice, I use berberine most often with hydrogen dominant SIBO and Alimax for methane dominant SIBO. These 2 antimicrobials remain consistent over a 40-day treatment window with 1 to 2 additional antimicrobials rotated in for better success. I often use neem plus and microbiome cleanse alongside berberine and Alimax. The use of biofilm busters during a SIBO treatment is controversial, but to make my protocols more effective, I often do use NAC or serrapeptase as biofilm busters for roughly 10 to 20 days of my treatment protocols. My last key tip here, many practitioners neglect the steps that follow treatment. Antibiotics and antimicrobials both have collateral damage in the large bowel. They are not selective to the SIBO bacteria only, so you must spend double to triple the length of your treatment working on rebuilding your large intestine microbiome with things like prebiotic fibers, digestive aids, and even sometimes probiotics. So to recap, SIBO is more common in people with endometriosis due to things like anatomical issues, medications, surgery, and autoimmune factors. It can worsen symptoms, affect nutrient absorption, and increase inflammation. But with a proper diagnosis and targeted treatment, you can start to restore your gut health and resolve your digestive symptoms. If you found this video helpful, please give it a thumbs up, subscribe, and hit that notification bell for more science-backed tips for living with endometriosis. Lastly, if you resonated with the content of today's video and you're ready to take action and heal your SIBO, whether you have a diagnosis or suspect it, click the link below for my Endo Belly to Bombshell course. This is my GI-specific course where I highlight everything and anything you would need to know about digestive health, including SIBO treatment protocols, treatment diet directions, meal plans, and much, much more. Let me know in the comments below if you suspect SIBO or if you have a positive SIBO result, and I will see you in the next video.